Since the start of the pandemic, most of us have experienced some form of lockdown, social distancing, or other protective measures to slow the spread of the coronavirus. But there is nothing else so visible and symbolic of our collective struggle than the face mask. This is Behavioral Science Toolkit, a series on behavioral science and its applications. There is now a large body of evidence supporting mask wearing as an effective tool in the fight against COVID-19. And the WHO, the CDC, and most other global public health organizations recommend their use to keep us safe. However, many countries that enforce mask wearing have seen some public opposition, sometimes even to the point of open aggression.
This is day one. This is opening day of Trader Joe's in North Hollywood.
But if this behavior has such an obvious collective benefit, what is causing this public opposition?
When people feel external constraints on their personal freedoms, they tend to lash out against those constraints by essentially asserting their individuality. And as soon as you feel somebody external is trying to essentially override your decision-making process, your internal decision-making process with their own constraints, you want to reinforce that you are in fact at the wheel.
We're joined by a behavioral economist to discuss this strange phenomenon.
My name is Syon Bhanot. I'm an assistant professor of economics at Swarthmore College. I focus in on behavioral economics and experimental economics. I've been on the faculty since 2015, and a lot of my work is sort of applied behavioral economics, applied behavioral science.
In 1966, while studying forms of persuasion, a researcher named Jack Brehm noticed that under certain conditions, people would exhibit strong resistance to attempted social influences. Brehm named this type of social opposition, motivated by a perceived threat to personal freedom, reactance. When we feel like our range of potential decisions is being limited by an outside force, we react by changing our thoughts, beliefs, and behaviors to fight the threat and try to restore our freedom. This can even cause people to behave in ways that they know is not in their best interest.
You can think of a silly example being that, I personally don't have kids, but everyone I talk to who has kids seems to suggest that when you tell your kids to do one thing, they suddenly want to do the polar opposite of that thing in a lot of circumstances. And so it's the same idea here. We feel this sort of external limitation on our behavior, and we kind of think, well, I'll show you. I'm an individual agent, and I can do the opposite if I'd like, and you don't have control over me.
But we don't act like rebellious teenagers every time our decision-making is limited. In fact, we only fight threats to our freedom when we think it's a fight worth having. If a threat is too small, say, a child approaches you and declares that under their authority, you are no longer allowed to eat candy, you would likely deem that threat too insignificant to be worth your time and effort. And on the other side, if you feel as though a barrier is too great to overcome, you might give up trying to change it. Like continuing to drive a car, use plastic cups, or eat meat because you believe your actions won't solve global warming. But between these extremes lies the land of reactance, where you perceive the threat to be large enough to care about, but not so large that you think nothing you can do can change the outcome. This is where people who refuse to wear masks live. And yet, research shows that when a restriction to freedom is for the collective good, like mask wearing, reactance is less likely to occur. So what are some of the factors that might cause reactance, even when limiting choice is beneficial?
One of them has, in my view, is empathy, right? So to what extent is the person basically feeling those constraints? To what extent do they feel that the people trying to put those constraints on them empathize with, understand where that person is coming from?
Studies on reactance show that when you feel that the authority that is restricting your freedom is illegitimate or doesn't have your best interests at heart, you are more likely to oppose that authority, which relates to the second factor that Syon mentioned, social identity.
People with certain identity characteristics, being a fan of this football team, being a student, being a doctor, whatever different identities you adhere to, you get utility from being closer to the preferences of that identity. You're more open to feedback from people who you perceive as sharing your social identity.
In the US context, it's easy to see how the dynamics of social identity have influenced behavior. Americans have increasingly felt more loyalty to their chosen political party and less trusting of the other. And this distrust has extended to the pandemic and mask wearing.
If you think about how do these like individual reactances build up, well, you can imagine they essentially form part of, for example, the I'm a Trump supporter identity. It's like, well, Trump supporters don't wear masks, right? And I'm obviously reinforced by when Trump had COVID, he goes to the White House and dramatically takes his mask off, basically saying, like, if you're with me, this is what you do, right? You don't wear the mask as soon as you don't have to anymore.
But at the beginning, support for the safety measures proposed to slow the spread of the coronavirus were not divided along party lines. Syon told me about some surveys he and his colleagues conducted on the way pandemic safety attitudes changed over time in Pennsylvania.
We conducted these surveys kind of over the course of the summer, asking people's political views and views about COVID restrictions and things like that. And what we found was this sort of persistent, or sort of where there wasn't initially much of a gap in terms of support for social distancing by political party. It kind of opened up as here in Pennsylvania, the topic of shutdown and what the governor is doing. Governor here is a Democrat, right? And he was sort of more proactive, I guess, relative to some other governors in terms of taking steps, but in so doing, angering lots of people and making it seem political. You saw this kind of gap form in support for social distancing and those kind of policies, only really when the politics came in.
Because of political polarization, a portion of the population sees the call for mask wearing and other safety measures as coming from an illegitimate authority. And as a result, reactance flourishes and individuals start to change their beliefs and behaviors to more align with those in their own political and social identity. But identity is not the only issue here. While looking to leaders to direct our beliefs and behavior as human, so is looking to our peers to guide us. If we see others not wearing masks, we think it must not be so important. So in stores, or on public transportation, or at family gatherings, if you see that other people aren't wearing masks, and there seem to be no negative social consequences for them, you are more likely not to wear one yourself. Syon conducted another set of surveys with residents of Philadelphia, examining this effect.
Residents of Philadelphia, when you ask them how seriously they take mask wearing and social distancing and those kind of things, personally, how important it is to them, they were very supportive of the idea that these are good things. But when you ask them what their neighbors thought, they thought, well, my neighbors don't care about this at all, and they're just a bunch of bums who, need to be taking this stuff more seriously. So that was kind of interesting from the perspective of social norms, right? We have people who, perceive that they themselves are doing the right thing, but everyone around them is nuts. But of course, we're surveying everybody. And so in the data, it turns out that everyone sort of agrees that like we should care about this, but nobody perceives that the collective agrees. And I think that makes it harder for those social norms to really like lock in and shape behavior.
So, you have individuals who are already primed to trust people from their own social identity and dismiss opinions and beliefs of the other. This mixes with political leaders, who are representations of these opposing social identities, leading the conversation on coronavirus safety measures, which further encourages psychological reactance. And add in the fact that, due to social norms, some people believe that those around them don't care whether or not they wear a mask, so they don't. But these problems need solutions because the virus...
It's not actually a fundamentally political problem, it's a biological problem.
Stay tuned for part 2, where Syon and I discuss solutions for fighting reactance, establishing more positive social norms, and encouraging mask wearing more generally.